Oh,
Hi.
hi. Sorry about that.
No, it's okay, don't worry.
How are you?
Yeah, I'm good. How are you?
I'm also good. Yeah, it's nice to see you and to talk to you. So I'll just do a little quick introduction.
Sure.
So, hi everyone. Today I'm here with Rhiannon, and we're going to be talking about health inequalities in the UK. And so, could you just start by giving a bit of background on who you are, where you're from, and maybe some information about your past involvement with this issue?
Yeah, so my name's Rhiannon. I am a medical student at the University of Cambridge. I grew up kind of in the Bristol area. My family are Welsh and Armenian. Um, and how did I get involved in health inequalities? So I got involved in health inequalities work because I think kind of in my second year of studying medicine, it became really clear to me that we weren't really healing people. We were receiving people who were sick because of a broken system, and we were kind of putting plasters on them and then sending them back to that system. And we weren't making the structural changes that would enable people to live flourishing lives. So I became quite disillusioned with medicine at the time. And then I started getting into kind of more human rights work, and then looking at pharmaceutical companies in particular. Looking at access to medicines, which of course is still super relevant for things like tuberculosis and neglected diseases, but also COVID vaccines as well. And then through that, kind of got into climate campaigning as well. So yeah, it's been kind of a long road, I would say. But I would say overall, I kind of came to health inequalities through wanting to help people be healthy. So I did medicine, and then I was like, oh, people can't be healthy in a system which is designed to make them unhealthy. So that's how I kind of then got into like health justice work.
Very interesting. So you must, as a medical student, yeah, you must have a first-hand perspective as to what kind of experiences people are having. So you already touched on this, but what sort of health inequalities exist in the UK, and are they evenly spread? Because I know that in the UK there's a great economic divide between the North and the South. And then also,
Mm-hmm.
what is the root of these problems?
Mm-hmm. Yeah, so that's a really good question. So the definition of health inequalities is avoidable and unjust differences in health outcomes between different groups. So that can be things like how many people in a particular community are living with chronic disease or dying in childbirth or suffering from mental health issues. And health inequalities, I think, it often sounds intimidating because I think medicine has been made quite inaccessible to people. People are like, oh, like I don't know anything about health. But actually, health inequalities kind of just mirror wider social, economic, and social oppression. So, like inequality that exists in society along various lines of inequality. So, for example, if you have socioeconomic inequality, racial inequality, gender inequality, those are all then reflected in health inequalities. So, the health of people's bodies is in many ways a reflection of how just or unjust and how well your society is functioning.
Mm.
So in the UK, you mentioned we have a huge amount of inequality between the north and the south of the UK. A lot of that is economic inequality, and that's reflected in the health of those populations. But you also see it with, for example, like transgender people in the UK suffer from really horrific health inequalities, and so do ethnic minorities as well. So there was a lot of data during COVID showing how people from ethnic minorities in the UK were more likely to die of COVID, and there was a whole load of like bogus theories, like blaming like inherent biological differences, which was just not true at all, because it was simply a reflection of those groups being maltreated in society and facing more oppression and more injustice in society. And it's like when you think about health inequalities, you kind of need to think of it at a few different levels. So you have health inequalities which occur in healthcare itself. So this is like access to healthcare. So like if you can like get to a healthcare professional, and then also how you're treated when you get there. Like, are you given the same treatment as other people? Like many people are not. So it's, can you get there? If you get there, is there like medicines that are affordable to you and that meet your needs? Is there kind of treatment that's appropriate to your life and your community? Is there like accessible treatment, that kind of thing? So there's like within the healthcare system, but the majority of health inequalities occur kind of outside of that system. So if you look at like a person's kind of immediate surroundings, you've got like the food that they're able to access, their housing, their income. Like if you can't afford healthy food, if you can't afford the bus to the doctors, but then you've also got to think about not just kind of the immediate practical things, but the long-term impacts of structural inequality, because it's not just things like not being able to purchase food, it's things like social inequality embeds itself in the body in the long term, in form of the stress of living in an unequal society becomes embedded in the body. So you see chronic stress, which then manifests in health inequalities for people living in poverty, people impacted by structural racism. So as well as the kind of immediate as well as the immediate health inequalities things, you have the long-term impact of structural oppression. And if anyone's interested, it's called allostatic load, which is basically where your cells are like, shit me, this is hard, and they just get exhausted and they get tired and you get unwell more easily. But I think also in the context of the UK, it's really important to think about the global inequality in health that the UK actively facilitates. And I think it's really important to like draw links between inequality in the UK and the health inequalities which are faced in the UK, and global inequality caused often by industries which are based in the UK. So if we look at the practices of an oil company, say, so there's huge health inequalities in the UK based around air pollution, which is because mostly due to the burning of fossil fuels, and that pollution tends to be concentrated in areas where there's a lot of poor people and there's a lot of people of colour, because, you know, like the rich people don't want the polluting factory right next to their house. So you have air pollution in the UK, mostly caused by fossil fuels, which then creates health inequalities. But then those same companies are extracting oil from places like the Niger Delta. So, and then you see what happens in the Niger Delta. Because of the oil spills, because of the violence, the Niger Delta has a life expectancy which is 10 years lower than the rest of Nigeria. So it's really important to see how the health inequalities which occur in the UK are linked to global inequality, and especially in the context of the climate crisis. But also if you think about what's a good example is the UK's obstruction of global access to COVID vaccines. So, for example, like the UK has been obstructing various efforts to make sure that developing countries can have access to the COVID vaccine. So you have inequalities at home, which are then kind of reflected in by the UK's foreign policy as well. So even though we're talking specifically about the UK, the global impacts of inequality in industries based in the UK and the UK's foreign policy are really important to think about as well.
Yeah, and I think you talked about this, the fact that it's hard for people to escape these health inequalities if these inequalities are built into the system. Been attempts to fix the flaws in the system and to give people more access, and if so, have they been effective?
Yeah, so I think there's some kind of important things to think about when we think about health inequalities. So one of them is that the concept of health has been very, very individualized, in particular since kind of like Thatcher neoliberal era. The dominant narrative around health, which kind of, as we've just discussed, this is actually really not true, is that your health stems from your individual behaviors and what you practice. So it's like, okay, if you're unhealthy, you should exercise more, or if you're suffering from a lung disease, you should stop smoking. And none of those things are necessarily untrue, but the emphasis is placed on the individual. Like your health is you have agency over your health, and you should do X, Y, and Z, which means there's a massive, and I'm not saying that like people don't have agency, but that agency is significantly limited, right? Because like the whole idea of the individualization of health is to hide systemic oppression. So it's saying, okay, well, like people are suffering from this health problem because they're not exercising enough, right? And it hides the fact that like maybe they can't exercise because the government has just built huge numbers of like privately owned luxury flats all around their area, and there's no green spaces, or maybe they can't access healthy food because the like fast food industry has just lobbied to completely change government regulatory standards. So the whole point of individualizing health is to hide the systemic policies which are undermining people's health. So that's kind of where we are. And I think also as part of that, health is depoliticized. So it's made like a personal responsibility, and kind of taken out of the political sphere. In the UK, the NHS is very political, and always has been, but those wider determinants of health are like massively ignored in the discourse around health, and it's really put on individual people. And yeah, as we said, this like is it's a deliberate tactic to hide policies which like policymakers and companies know harm people, or they know harm the planet, and they know that these policies are harmful. But if you say, okay, well, it's your responsibility to exercise more, it's not like the government's responsibility to make sure these corporations aren't exploiting you, then you can get away with more. So it deliberately facilitates an unjust society by blaming people's health problems on themselves. So that's why basically lots of efforts to tackle health inequalities haven't worked. So lots of efforts to tackle health inequalities have focused at like a very individual level, or like a very kind of isolated level, being like, oh, like how do we like better reach hard to reach communities, and like, well, how do we do, you know, and like stuff like that, which is really like quite problematic and focuses very much on the individual. And that's why in the UK health inequalities are rising, right? So because you don't have, and because also the whole time while this has been going on, yeah, there has been more of a conversation around health inequalities, but the conversation has been, oh, like people on low incomes are like more likely to suffer because of health inequalities. But the conversation hasn't then gone to, right, okay, well, why is this? Like, why is the government actively choosing to implement policies which they know are going to kill disabled people, for example, which is what the universal credit does. So a lot of work on health inequalities hasn't actually made that much progress because it's fallen into that same trap of health as an individual responsibility. But like some good examples tend to be like general, like progressive socialist policies, which and this is, yeah, I think we'll kind of come back to this later, and it's kind of intuitive, right? Because like health, again, like we were saying earlier, has been kind of like overcomplicated. People know what's good for them. People know exactly what's good for them. People know what's like healthy for their bodies. People know that being treated like shit at work is bad for them. So things like progressive social policies tend to be good for people's health. So if you look at trade unions, there's like a direct association between like the quality of trade unions and like the progressiveness of trade union laws and workforce health, which is kind of obvious, right? Because like if you have strong trade unions, you have better safety at work, you have better pay, you have better sick leave. So for example, during the pandemic, the UK's sick pay was a massive problem. People had to go to work when they had COVID because they couldn't afford to be on sick pay. Lack of protection at work, for example, in PPE and COVID. But all of these issues, which are like classic progressive issues, are good for health. So it's not enough to say like, oh, like, you know, exercise your way out of exploitation in your workplace. No, like unions and organizing in that way are good for health. And then another really good example also centered around unions is housing unions as well. So housing is a massive determinant of health. And in the UK, we have a huge problem of there's not enough social housing, but also housing that does exist is really poor quality. So there's like really low standards on what's expected from like rental landlords, for example, but also social housing, even run by the local government, for example, is often like really, really bad. So people like Acorn Union or housing activists or progressive local council policy literally help to prevent things like asthma, prevent things like chronic lung disease by improving people's conditions in their homes. And again, this isn't the kind of thing where it's like, oh, just like save for a better home. Like, no, systemic policy and systemic exploitation means that like bad housing is forced on people. So yeah, so I think like basically classic progressive issues which focus around justice and equity and undoing wealth inequality, all of those things are health issues, and it's a question of connecting that and making that more obvious.
Yeah, and I think also what you're bringing up is the fact that health has so much more to do with our everyday lives than just going to the hospital, and improving health and starts by improving communities and improving the day-to-day lives of people so that they don't have to end up going to the hospital and paying for all these expensive medicines. So considering all of these options, what are the barriers to implementing these policies, and what is the thinking of the politicians who keep implementing these policies that are blocking access to healthcare for these people?
Yeah, so I think like one of the key things to kind of like talk about is that in capitalist societies, the only goal of the economy is profit and wealth accumulation, right? And that requires exploitation of people, and it requires exploitation of natural resources. So if you're a government which subscribes to that, like the Tories, then that those are your goals, right? And like any improvements in like health and well-being are like a nice side effect if they happen to occur, but they're not the aim of your economy. And I think that's really, really important, right? Because you can't just be like, oh, economic growth and then everyone will be healthy. No, if your economic growth is based on exploiting people, or is based on like putting sewage into rivers in the UK, for example, then that's not automatically going to lead to an increase in well-being. And we've like for decades had this like really completely illogical, and most people, if you talk to them kind of in simple language about this, realize that it's completely illogical. If you have an economy whose only goal is profit, then it's going to destroy the planet and it's going to harm people, right? Because like if your goal is not to look after people, then that's not what your economy is going to do. So I think like economic growth as the main indicator of like development is a massive barrier until we get over the idea that like, you know, GDP is any kind of indicator of well-being. I think it's going to be really difficult. And I think another barrier which is really key is, and this kind of comes from colonial mentality in particular, is the idea that human health is separate to the natural world, or like humans are not part of natural world, not part of nature and ecosystems. Mm-hmm. So this was like in the UK part of the enclosures in the 12th century, and then like as colonialism expanded, a core part of colonialism is like disconnecting people from land and being like nature is this like static thing which we can exploit for our benefit, and that will be good for us and it won't be bad for us, right? It was actually, if you think about on a super simple level, all the things you need to live a healthy, flourishing life, like water, food, land, a home, decent, like weather that doesn't destroy you. All of those things are entirely dependent on the health of ecosystems around you. And that's what, you know, indigenous communities have said since like the dawn of humanity, right? And that's how they live their lives. And that's why those communities are so sustainable, because they recognize that humans are part of natural ecosystems, not separate to them. And if you destroy the foundations of ecosystems, you're also going to destroy the foundations of human health. So in terms of barriers, I think until we see human health as a core part of planetary health, and human health as entirely dependent on the health of our relationships with non-human animals, with ecosystems, with the water, with trees, with soil, until we really see those connections, which are there, right? Like nutrient depleted soil means nutrient depleted food. It's like, you know, and people know that. Yeah. So I think those are two really, really big barriers. And I think to be honest, they're ideological barriers, because there's nothing to stop us living healthy, flourishing lives. There's more than enough resources. There's more than enough ideas and ways of doing it. It's ideological barriers.
Mm-hmm. Yeah. So considering all of this, do you think that there is room for improvement? Do you think that it's a possibility that over the next decades that we will slowly, that policies will begin to bridge these inequalities? Do you think that's a possibility?
I think that's all to play for. I think not the direction that we're going in the moment in terms of like climate collapse and like the increasing rise of the far right and increasing like austerity and neoliberal policies. But what we are seeing is, in the face of that, lots of different struggles coming together, and I think that's where health fits in. I think it's not its own struggle, it's a link that links between lots of different struggles, like global injustice, like land back and ending colonization, gender justice, racial justice. All of those issues are related to health, and it's like linking those. So I think kind of the hope that I have is that like more health people will become involved in linking and linking different social movements and thinking in like a collective liberation mindset, rather than like a one by one, oh, this person has lung cancer, we're going to do X. Like, no, like how can we collectively liberate ourselves from systems of oppression in order to all live healthy, flourishing lives. And you know, we are seeing so many amazing social movements come together, and to say, okay, not only no to all of these bad things, not only no to racism, no to the climate crisis, no to inequality, but also like yes to a healthy, flourishing society, right? So I think in terms of going forward, I think that's the way forward, is like viewing health and using health arguments and using health workers to support those fights for collective liberation and have them as part of that. So yeah, that's what that's what I'd say, I think.
Wow. Well, thank you so much for all your insights. And I think definitely, especially as someone who lives in the UK and studies medicine, I've really valued hearing your opinion and just, you know, seeing your perspective on all of these issues, and also seeing how you view the different intersections with different ideas, which with different problems in society, which is very true, because you can't solve one social problem without acknowledging the things that interact with it.
Yeah, yeah,
Well,
exactly.
so much for joining us today.
You're so welcome.
Okay, bye. Thank
No, bye bye.